ED is a devastating problem for people. I certainly am reminded of that every day in my clinic, seeing people who come in and are nervous to even start talking about this problem with a stranger. Erectile dysfunction is the inability of the patient to get or maintain an erection satisfactory for intercourse. The complaint itself kind of defines a condition, but the patient might tell you things like, I noticed a change, doctor, in the frequency with which I woke up with erections in the morning. Someone who tells you, again, doctor, this is an intermittent problem. It'll bother me for a couple months, and then it goes away, then something changes and it'll come back. Or patients who will tell you that there are specific times during sex that this becomes more of a problem. Generally speaking, that kind of a complaint makes me think more about a psychogenic cause for ED than an organic cause for ED. There are a fair number of other sexual dysfunction complaints that you might hear from someone who is reporting ED. Someone might have observed that there is an inability to control the time involved in reaching an orgasm. Other people who might notice that they are unable to reach orgasm or ejaculation. People will experience having a pretty significant change in their interest in sex, and we would term that in the medical community a low libido. Any of those complaints ought to make you at least think about the possibility that the underlying issue is a change in the patient's testosterone levels. And so we call that condition hypogonadism, and we investigate that with some blood work to check a testosterone level in the patient. I think there's two reasons it's important for the patient with this issue to come in and see a doctor like myself. The first is to get some treatment, to get some help. There's no reason to suffer in silence. Come in and we should be able to help. But alongside that, it's on us to try and help you get healthier. If this is due to some medical condition that you don't know about, let us try and figure that out. It's several times a year I'll make the diagnosis of diabetes, and a patient sitting in front of me in clinic doesn't have another doctor, doesn't know they're diabetic. It's bad news, but it's a very important health intervention that needs to occur thereafter in order to keep that patient healthier.